you been suffering with pain that's deep in your buttock and radiating down the leg? Some people have told you that it's piriformis syndrome, others have told you it's sciatica. You've been online, you're not sure which. Well, hopefully this video will unravel that. I'm Anthony Gosh, I'm the lead neurosurgeon at the Spine MDT. Don't forget to like this video and please subscribe to the channel so you can stay up to date with videos that we post every week on problems with the spine and ways you can maintain a healthy back and healthy spine. So if you've got pain deep in the buttock radiating down the leg, let's have a look at some of the anatomy so that we can first understand the different things that can cause that. Broadly speaking, the two things that get confused or sometimes mimic each other are slip disc herniation and a trapped nerve causing sciatica, or piriformis syndrome actually causing sciatica as well, pain going down the leg. So this is a side view here of your spine. That's the front, that's the back, and there are nerves that leave the spine in the lumbar region. These eventually leave the spine and form a bundle called the sciatic nerve. So think of that as a big electric cable, and the nerves, the individual wires that go into that cable. And then that cable itself then forms different branches that go down to the leg, innervate different muscles, and give the sensation to different areas of the skin. Anywhere along this course, if that nerve is damaged, inflamed, or trapped, it will give pain or possibly numbness going down the leg. The commonest cause of that is usually a slip disc, is impingement of the nerve within the spine. So that's a view here of looking a slice across your waist and looking upwards. This is a piece of disc material here that's herniated out, pinching the nerve, and that sends pain radiating down the leg. Piriformis syndrome is centered around the piriformis muscle. That's a muscle that you can see here that comes from the sacrum of the spine, the very lower bit of the spine, just above the tailbone, inside the pelvis, that goes over to the hip. And there's a channel just behind that the sciatic nerve then runs through. No one fully understands the cause of this, but usually this muscle is believed to go into a spasm for some reason. Either it's been used asymmetrically compared to the one on the other side. It spasms and it causes pain deep within that muscle, and that's the buttock pain itself. And then it irritates and inflames this sciatic nerve, which gives you the pain down the leg, just as a slip disc would do. Commonly, patients complain mostly of the pain deep in that buttock. When you press on the buttock really hard and examine someone, that really flares up the symptoms. It really kicks in the pain deep in the buttock and makes it shoot down the leg. That's one of the ways that you can work it out clinically. I've recently seen a lot of paid for misinformation content on social media about piriformis syndrome, where people are being told that they are lied to by their surgeons and doctors about the cause of the pain radiating down their leg. They're lied to. It's not a slip disc, it's piriformis syndrome. And then later on in the video, they're trying to sell you some stupid plastic cup that somehow magically sucks out all the badness in your body and alleviates the pain. Therefore, it's really important to undergo a good assessment by a professional, healthcare professional, be it a spine surgeon, a good physiotherapist, a musculoskeletal physiotherapist, or even osteopath or a chiropractor who actually understands a bit about the anatomy of the spine, the sciatic nerve, and these things, who can try and clinically tell the difference. So diagnosing piriformis syndrome itself is often a diagnosis of exclusion. Common things are common. If you have sciatica pain in the buttock shooting down the leg with numbness and tingling in the leg, you have to rule out a slip disc. And that's done with an MRI scan of the lumbar spine. If that doesn't show a disc impinging the nerve, if there isn't a disc pinching the nerve, and it doesn't fit with the pain going down the leg, then piriformis syndrome is something to consider. And again, it goes back to the clinician reassessing you clinically, palpating on the buttock, pressing, seeing if that reproduces the pain. Sometimes an MRI scan of the pelvis itself can show you an enlarged piriformis muscle and possibly the channel that the sciatic nerve runs through, although that often doesn't show that, even though patients have symptoms that mimic it. And one of the other causes of piriformis syndrome is believed to be dysfunction of the sacroiliac joint. I've done a video on that separately, sacroiliac joint dysfunction, which is the joint between the pelvis, this big pelvic hip bone, and the spine itself, where we've got these two dimples in our back. If you look in the mirror, pain in that region or dysfunction of that joint normally gives just pain in the buttock and back area, but sometimes disruption of the joint can cause spasm of the piriformis muscle itself that can then irritate the nerve. So it's a careful diagnosis, and it's not the first thing you try and exclude. So how do we treat it if we believe that's what's caused it, i.e. you've done a set of investigations that have excluded a trapped nerve in the spine? Well, it's mostly things like physiotherapy, specifically stretching out that piriformis muscle. So exercises that work on your hip and stretching that stretch the muscle out can sometimes release the nerve. It does settle down in most patients. And also there are corticosteroid injections into the region as well that can be helpful, just take down some of the inflammation around the sciatic nerve. Also, simple painkillers over the counter as well, such as anti-inflammatory drugs, paracetamol, ibuprofen. And then if you need anything stronger, that's where it's a good idea to go and see a healthcare professional to make the assessment, but also help you get through the pain. And the reason I say painkillers is, in the majority of patients, it will actually settle down without anything too invasive. Well, some people might ask, well, you're criticising these online social media posts or ads about piriformis syndrome and these devices that you can stick on your spine. Well, some people have got better with it. Well, the natural history of it is that it will improve anyway. So often it's just an overlap of that, and it's been perceived as this stupid magical device helps you get better. I think it's very important you have a thorough assessment of a good healthcare professional, be it your GP, your spine surgeon, a good musculoskeletal physiotherapist that sees this sort of stuff, to get the right assessment done, and then follow the right process of investigations, a process of exclusion to get to that diagnosis. It's very rare. I hope you enjoyed the video. Hope you found it helpful. Please click on the link below. You can look at all our blogs about different conditions of the spine. And as mentioned earlier, please subscribe to the channel. It helps. It also keeps you up to date with posts on the spine and maintaining a healthy spine and helping you out with conditions of your spine. Our goal at the Spine MDT is to find the least invasive solution, but that also gives you the longest lasting result. We're able to do that through our one-stop clinic to get to the diagnosis quickly, but also by working in a team of all professions of spine care, spine surgeons, pain specialists, physiotherapists, osteopaths, and chiropractors, all with that same goal in mind in one organisation. Please feel free to visit us on our website or email us or call us, and be very happy to help you. Thank you.